The foot is made up of three arches: the medial arch, the lateral arch, and the transverse arch. These arches work together to balance the foot on the earth, and these arches make it so that you are really only contacting the earth in three places: heel and each side of the foot pad. It is on this three-pointed triangle that we walk. The medial arch is mainly for weight bearing, and the lateral arch outside of the foot is more for balancing. Strengthening the transverse arch. Notice your client's foot. If the transverse arch is fallen, the client may have a callus in the center of their foot pad. In this case, we need to strengthen the fascial lines under the metatarsals. Clients can do this by gathering cloth with their toes. This will strengthen the arch. We can also help this process by making sure the fascial bands across the top of the foot have enough give to let the foot move back into balance. Use the thenar eminence of your palm on the dorsal part of the foot while your fingers brace on the bottom of the foot. Gently spread. If the client has a fallen transverse arch, direct the pull towards the dorsal part of the foot and follow the fascia where it wants to go. Our pull is light. We're looking for a sense of release, and we're being patient. Follow the tissue as it releases barrier upon barrier for 2 to 5 minutes. Remember that we can't overstretch fascia with such light pressure. We literally can only release restricted fascia. The most harm we can do to our clients is to waste their time. The supinated foot. With a supinated foot, the bottom of the foot points slightly inward. This may result in a high arch, wear on the outside of the foot, wear on the outside of a shoe, or restriction in pronation of the foot. To help balance this posture, we'll release the muscle and fascia of the tibialis anterior as well as the medial arch, and we may want to refer the client to someone that makes orthotics. Position your client face up. Evaluate the fascia over the anterior compartment, noting the movement superior to inferior. Then use a cross-handed stretch to release this area. Sink into the tissues. Let the fascia unwind.